Hello, just doing a little video about peritoneal dialysis manual. If they're going to be using the cycler for their peritoneal dialysis, the dialysis nurses are going to do that. But if we need to do it manually, the dialysis nurses will start it, but then after that, we'll be handling the process from then on out. So make sure you check your orders, verify the time, the dwell time, the dialysate, and everything like that. And I just want to show you what their catheter will look like. So their actual catheter is from the insertion site to about right here. When you look in Lippincott at the process, it talks about a transfer set. This is the transfer set. They're not talking about the infusion set, okay? So the transfer set is what has the little connection cap to it, okay? And this is the cap, the iodine cap that gets removed, okay? So patient to right here is the actual catheter, and then sometimes the dialysis nurses have to change the transfer set to the type of transfer set that we can connect to the infusion tubing that we have. They will do that, okay? So again, they'll do the first one, and then we have to handle it after that. So the first thing that you want to do is get this thing clean, all right? So we have to do it in a sterile way. So your patient's going to be sitting up at 30 degrees. Sally here is just going to be laying flat because she's a mannequin. But a lot of fluid in the abdomen. We want to make sure that they're sitting up at least 30 degrees if they can tolerate that, if it's not contraindicated. So you want to get a utility drape. A utility drape is small. You don't have to get a whole OR drape, but you might have to call materials for it. Just ask them for a utility drape, okay? It's nice and small. So this is going to be sterile to create your sterile field. Make sure that you clean off your bedside table before you do any bedside procedure, whatever you're going to have your supplies on. So like anything sterile, you want to make sure the outside that we're touching is going to remain sterile. So open it up in a sterile fashion, and then the outside is what we're going to use to kind of spread it and create our sterile field. Okay. So we're just going to lay this down. I've been playing with it so it's not opening up as easily. But kind of underneath where the catheter is, because right now it's dirty, but we're going to make sure that we clean it and then be able to lay it on our sterile field, okay? The other thing that you can go ahead and do is get your sterile gloves and drop your ChloraPrep. So go ahead and open up your ChloraPrep, and you can just drop it here. I'm just going to pretend this is a ChloraPrep, okay? And then just dump it, okay? So let's just say that's sterile. Dumped it. All right, so do your hand hygiene and everything, and you're going to need your gauze here. So you can go ahead and open these up, and you can use, I think using the ChloraPrep is easier, but they have two kinds of solution. You want to make sure you're using the right one. One has bleach in it and one is safe for skin. So the one that has bleach in it is what you're going to use to clean the catheter site, to clean the catheter, and this one is used to clean the site. But I just like to use a ChloraPrep again. They're not allergic to it, okay? So you're going to take your bleach solution and make sure you put a label on it to make sure that it says, you know, what it's for. It has bleach in it, just because people do wrong things with stuff sometimes. And you're going to saturate the gauze inside of here completely. Saturate it nice and wet. We want it nice and saturated, okay? And then you're ready to get started. You're ready to get sterile. So of course you do your hand hygiene. You know how to do that. Get your sterile gloves on. And you're going to pick up your catheter here. And here's your catheter. So you're going to take your gauze and really clean it really good. Really, really clean it up and down the whole catheter. Drop this, not on your sterile field. Really, really good all the way down, starting from here, and then clean down to the patient. And then you're going to take some of these gauze and you're actually going to wrap it around. Okay? And then you're going to put this whole thing on the field, and you're going to take this ChloraPrep and you're going to scrub really good around the insertion site, because we're trying to kill any drugs or any germs or anything that could infect the patient or possibly affect this. So the next thing that you have to do, this is going to sit for at least 5 minutes, and then you can go ahead and set up your infusion set. So when you get your infusion set, it's going to be right here. It comes with the dialysate connected to it and the drain bag. So put a chuck on the floor and put your drain bag on the floor, and then go ahead and hang this. You have a little seal to break when you get ready to prime this. Don't break it yet. Go ahead and hang it and get it out of your way. And then you want to have 2 clamps. You can get these clamps, and you're going to clamp it at the bifurcation. So this bifurcation right here, clamp it in both places on both sides, because one is to the drain bag and one is to the fill bag, okay? So this is ready to go. And then when you get ready to connect, which you're almost ready to connect, you're gonna have to get sterile again. So let's just say we're gonna get our new set of sterile gloves on, and we're going to pick up this part with our non-dominant hand, and then we're gonna grab the catheter with our dominant hand. Oh, I'm sorry. What we're gonna do is we're gonna grab this with our sterile hands, both of our hands, okay? And then we're gonna take this cap off first, okay? And just drop that to the side. Then we're gonna keep this sterile, and then we can pick this up and we can get this cap off, okay? So we just simply need to take this cap off. Now you develop some nurse dexterity over the years. Just pull that off, and then that's what it looks like, okay? This is what it looked like. We are not to touch this part at all, okay? That piece was stuck there because it's old. Now, when we go to connect this, that's all we're doing, is connecting it right here. Now we don't have to be sterile anymore, and that's it. So we are going to prime first before we drain, because we need to prime this because we don't want to get any air in the patient. So release the clamp that goes to the dialysate bag, crack the seal, and it's going to drain all the way down to the bifurcation, and then you clamp it again, and then you release this and lay it down, position your patient so that whatever's in their belly begins to drain out. So when they're done draining, it might take about 20 minutes, then you need to fill them back up. So then you're going to clamp the drain line, and release this clamp and let them fill all the way up. Okay, they're still connected, okay? Now it has to dwell for that period of time. You need to disconnect them from the set. You need to do everything sterile all over again. Okay, so when you get ready to disconnect the patient because all of the dialysate has filled up their belly, and then you know it's going to dwell for a certain period of time, what you need to do is get your clamps and clamp off the dialysate, okay? And you need to prepare your sterile field again. So let's just say we put our other sterile field out here. We're gonna get our new sterile cap that we're gonna switch out. You can drop that on your sterile field or have somebody that can hand it to you so you can pluck it out in a sterile fashion. You're gonna clean everything again. I'm gonna dump my little ChloraPrep over there. Let's just say we dumped it in a sterile way, and you're gonna repeat your process. So you poured your bleach, you're gonna clean this whole thing, okay? And this time you're cleaning a little bit of the transfer set, or the infusion set as well, all the way down. Clean it really good, and then wrap it up again. And that's gonna be on your sterile drape. All right, and let that set for a few minutes, 5 minutes, change your gloves, put your new sterile gloves on, okay? And now that you have your new sterile gloves on, you're gonna pick it up, disconnect it at that blue point, and put your new sterile cap on there. Again, we're not cleaning it. And then you just repeat the process later when it's time to drain them again.